Good evening. My name is Dr. Prajwal Hegde, and I am a senior consultant in Apollo Cradle Koramangala. Today, our topic will be hypertension in pregnancy, a very commonly seen problem in our patients. About 7 to 10% of patients who come to us in the antenatal period and who ultimately deliver with us do have some issue, whether it's mild, moderate, or severe. We are facing this quite commonly, so I thought it's a good topic to discuss. So, we have three types of hypertension. We classify it just to keep it easy and it's easy to explain to the patient is the mild form where the BP can touch up to 140 systolic and the diastolic touching up to 90. We can call it as mild hypertension. The moderate ones are between 140 to 149, 150 systolic and up to 100 diastolic. And then we have the severe form of hypertension where it is 160 or above systolic and 110 and above diastolic. So the severe hypertensions, of course, are immediately admitted and intravenous drugs are given to bring the blood pressure down. The mild and moderate generally we can treat as an outpatient basis along with regular antenatal care and advice as to their diet and how they should take care of them and when they should come and see us, what are the emergency signs and symptoms. They are counseled and then we tell them how to manage themselves at home till the next checkup. So, as part of antenatal care, we tell them about their nutrition, their nutritious diet, protein rich diet, and how they should avoid unnecessary intake of excessive salt, drink plenty of water, take enough rest, exercise about half an hour twice a day, some form of walking, and to sleep more on their left side, to observe the baby's movements, come for their checkups if there's any reduction in baby movements, if they can monitor their blood pressure at home with a regular Omron kit or whatever that they can find, and come to us if the diastolic is overshooting 90. We give them, if they are in the mild or moderate range, we tell them to start with some antihypertensive drugs just to at least not let it worsen and to be on the safer side. There are different types of hypertension. You can be a hypertensive patient even before your pregnancy starts. That is called chronic hypertension. You can have hypertension, which is called preeclampsia or eclampsia, which is high blood pressure along with protein in the urine, swelling of the body. This is called preeclampsia. Usually, it starts after the 20th week of pregnancy. And then there is preeclampsia superimposed on chronic hypertension. That is a patient already has high blood pressure, and over that she gets this preeclampsia and protein in the urine during the pregnancy after 20 weeks. And also there is the gestational hypertension, which also starts generally in the third trimester or after the 20th week sometimes. And gestational hypertension is when there is no proteinuria but BP is on the higher side. Usually it will settle down post baby within 12 weeks after birth. So the problems that a pregnant woman should be alert about when her BP is on the higher side are, we warn them about severe headaches, any disturbance in their vision, if they're seeing any spots or if they're having blurring of vision, any weakness or numbness, because stroke is also sometimes which can happen when the blood pressure goes very high. We also tell them to strictly watch the number of movements of the baby, to keep a strict fetal kick chart, to watch out for swelling of the face, swelling of the lower limbs, and also their urine output. They should pass adequate amounts of urine, and also the pain, which generally people think is gastritis, but that can also be another feature, is severe pain in the epigastric region or in the right hypochondriac region where the liver is. That is another symptom they have to watch out for, and also any form of numbness or weakness of the limbs. Blindness suddenly happens if it's left neglected. Very high BP can also affect the eyes, affect the kidneys, affect the lungs, affect the nervous system, and also the heart. So it's very important that for the baby to be fine, obviously the mother needs to be in the best of health. And neglected cases can even go in for eclampsia, where they can come in the middle of the night with fits. We have seen them coming with fits. These are all in neglected cases coming from the peripheries with no antenatal care. They can also come with bleeding, where the placenta can prematurely separate from the uterus. These are all avoidable conditions if they have had regular antenatal checkups. Now, who are the people who should have regular antenatal checkups, um, or who are more at risk of having high blood pressure? These are the ones who are obese, body weight, more than the basal metabolic rate. Should their BMI should not be over 25. The overweight patients who have a family history of high blood pressure, patients who have had high blood pressure in the previous pregnancies, patients who are diabetic or gestational diabetic, patients who are elderly, patients of African American descent, patients who have multiple pregnancies. These are all patients who are high risk for having high blood pressure in pregnancy. Sometimes we even prophylactically start them on baby aspirin between the 11th to 14th week of pregnancy to do whatever we can to prevent it from becoming out of control, and of course before it touches alarming levels. So the high blood pressure problem is a problem in the pregnancy. It settles post birth, definitely settles by 12 weeks post birth, but for that they have to not be hypertensive before the pregnancy, because if they were hypertensive before the pregnancy, then that will not rectify, it will continue. So what are the problems the baby can face? The baby can be growth restricted because the placenta is not giving enough nutrition, enough blood supply, enough oxygen to the growing baby. So the babies can be growth restricted. Smaller babies, you can have them weight much weighing much less than what they should be for that period of gestation. Their chances of being born premature are higher because we need to pull them out at the right time before tragedy strikes. And also the risk of a C-section, a premature birth, are higher when there is a blood pressure problem. So prevention is very important, especially in the urban setup where people are not probably getting their fair share of exercise. They're stressed, they're working, and now they work from home, which is causing a lot of these lifestyle changes. Not as much of exercise and food habits. All these things are contributing to the problem. So, how do we manage these type of patients? Is we have a couple of besides the diet and exercise and all these precautions that we advise them. If it is anything over 15 millimeters systolic over their baseline blood pressure, or 30 to 15 millimeters above, that is the systolic and diastolic pressure, above their normal blood pressure values. Then we put them on oral medication, the most common being labetalol nowadays. Previously, we used to use methyl dopa, where it's not available anymore. So we start with labetalol 100 milligrams up to 3 times a day, or even up to 6 tablets a day. And if it's still not controlled, then we go to calcium channel blockers like nifedipine, which is also given in case where labetalol is not helping adequately. And in hospital management, of course, is a little different. We give all these medications intravenously, whether it is labetalol, or whether it is magnesium sulfate, or whether it is hydralazine. These are all intravenously given. So prevention is better, to prevent it even before it reaches alarming stages. And so she needs to keep a watch on her blood pressure, especially these high risk categories, the IVF pregnancies, the multiple pregnancies, the obese patients, history of high BP in the previous pregnancy, family history of high blood pressure, diabetic, gestational diabetic patients, all have to be strictly monitoring their blood pressure, because these are things which we can prevent them from getting worse and out of control, rather than panicking and treating them at a very critical stage. So, lying down more on your left side, drinking lots of water, having half an hour walk twice a day, controlling your salt intake, um, not too much of sugar, focus on a high protein, high fiber diet, eat less of processed food, ready to make food. These are things to be minimized. And stick to your regular antenatal checkups, so that even if it is touching around 90, it can be fixed at the right time with medication. And at least the intention is to prevent the baby from being born premature. If we can take the pregnant woman and induce her at 37th week, then it's a job well done. So these are all the things that we need to keep in mind in a hypertensive patient. Very, very commonly seen these days, 7 to 10% of our antenatal patients are diagnosed with high blood pressure or gestational hypertension at some point in their pregnancy. So these are the questions which are coming up. Does yoga or meditation help control or manage hypertension? Yes, stress is a big, big contributor to high blood pressure. So relaxing the mind, doing yoga, meditation definitely will play a role in highly stressed individuals. Yes, it's highly recommended. Do hypertension medicines cause any negative side effects? Well, rather than worrying about the medicines, I feel the medicine should be taken as advised by the doctor, because the main side effects that we are seeing are nausea, vomiting, headache, which is not going to really have any detrimental side effects for the baby. Whatever medicines have been prescribed should definitely be taken and on time. Doctor, I have OCD, and now that I am pregnant, every little thing is getting to me. Does it mean I have hypertension? No. Having OCD does not mean that you have hypertension. If you have any doubt, you can have a portable blood pressure machine at home, and you can keep checking. Make sure that your systolic blood pressure is well below 140 and your diastolic blood pressure is below 90, and you have nothing to worry about. Can hypertension fluctuate both my and my baby's heartbeat? Hypertension will not fluctuate your baby's heartbeat, If the baby is distressed, of course, it will show either a very high level or a very low level, but not really affect the baby's heartbeat. Of course, if there are complications, like say the placenta has separated or the baby is in distress, then there will be fluctuations, and not really on your heartbeat unless it has gone in for those kind of pulmonary edema or those things are very, very uncommon. Not to worry about the mother's heartbeat. Will hormonal medicines cause hypertension? Well, if you mean the micronized, naturalized progesterone, no. So I've answered all of the chat questions. There are some questions on the top also. Can you please show me, Vikram? A few questions on the top. That's all I've answered.
Okay.
That's it. So this is a little bit about the day-to-day practice of high blood pressure, what we see on a regular basis, and how we manage. Every high blood pressure patient in pregnancy is taken very seriously because at the end of the day, we need the mother and the baby to be safe, even if it means delivering the patient and putting the baby in the NICU, even if it's premature, is better than after tragedy strikes. So it's always better to keep a strict watch on your blood pressure levels in pregnancy and seek help if you have any of the complications that have been mentioned before it's too late. Thank you very much.